Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jerina Gani. She's a primary care physician. Today's Kevin MD article is The Hidden Rewards of a Primary Care Career. Jerina, welcome back to the show.
Thank you. It's a privilege to be here and an honor. Thank you.
All right, so tell us what your latest article is about.
So the latest article is about, I was one more time, I had another podcast with you and I really enjoyed everything. And thank you for sharing that with the rest of the providers all over the United States. This one has to do with the pleasure of me being in primary care in the last few years. I am enjoying it more than before. I have been a primary care physician for 20 years now, but the last few years, the way I redesigned my clinic time. So the title is The Overlooked Treasure of Primary Care. People are going to think, there isn't any treasure in primary care. I think there is a lot of treasure in primary care, and I can explain how, why this field is more rewarding than most people realize. That's the title, and that's the way I feel. And if you want me to go ahead and explain this, I'll be happy to.
All right. So, yeah, I'm a primary care physician myself. As everyone knows, I do internal medicine. I see patients the first half of the week, and I interview so many doctors who are burnt out, and they say that there are so many obstacles in our primary care system, pre-authorizations and bureaucratic paperwork. There's a loss of autonomy in primary care. And medical students listen to that and wonder why anyone would go into primary care in the first place. So it's refreshing to hear your story and read your article about some of the treasures of primary care. So tell us some of the things that we may not know about primary care.
I totally agree. Primary care is busy, is complicated. There are a lot of things going on in primary care. There are, concerning things because not many people help us, but we have to be the CEO of our own care and CEO of our own job, as a physician, as a clinician. So if we do that and organize our time the right way and organize our day the right way, primary care is amazing. We can concentrate on the problems, all these, labs and tests and stuff, or we can concentrate as well on the wonderful things we get from primary care on a day-to-day basis dealing with people. So these are the rewards. I want to explain these hidden rewards that primary care has. So the first thing that I think, financially, for example, there are so many subspecialties out there, that especially medical students don't want to go to primary care because I feel like it's not financially rewarding. There's not much money in primary care. Why not, if I studied so many years, why don't I go to be a subspecialist and I'll make more money? I think primary care has a lot of potential, even financially. And I have seen that myself. So I've been working 20 years in primary care. The first 16 years, I was working full time, seeing patients every 20 minutes. So it was very, very tiresome. Even on the weekends, I was working. In the last 3.5 years, I organized my life very differently. So now I see patients every half an hour, only 3 days a week. So I see 16 patients in a day in primary care. And by doing that, I have so much time with every patient. I have time to talk to them and, not only to deal with their medical issues, but even 5 minutes on every visit, having that human touch, a little story from their life or exchanging what's going on is so rewarding, is so fulfilling. It regenerates me as a doctor, believe it or not, because I'm learning from them too. They learn, and being a primary care doctor or primary care clinician, because I'm talking here even with nurse practitioners or physician associates who are now clinicians, they have their own panel. It is very rewarding that way. And financially too, what I've realized? By working 3 days and see patients every half an hour, I have so much time to document everything I do. And by documenting and asking all the questions medically on patients and resolving as many medical issues they have, I'm billing a lot better now. And by billing better, I'm reimbursed a lot better. So I'm reimbursed for all the work I do. And I realize that in 3 days, I make more money than full time. It's very strange, but that's the way it's going on. And if I shared this in my online course, but I'll talk about that later. Regarding the hidden rewards, right? Emotional rewards are unbelievable. We have generations of people. We see the grandparents, we see the parents, and we see their children. Especially when you're with these patients, for over 10 years. I have been with them for many years now. And then I know every little bit of their story. So it is so amazing when you see the grandparent and then they tell you that, oh, they had the wedding of the grandchild, which is also your patient.
Hmm.
And they share that moment. And I ask them, okay, show me some pictures. Only those moments I spend with them regarding this. Oh, it makes me feel so good. It makes me feel so wonderful. Another thing, I practice in Massachusetts. So everybody practices in different parts of the United States. Here we have a lot of people from all over the world. And I am an immigrant myself. I came in the United States 30 years ago. So I am so amazed with the experience I get from people all over the world, who came here and they share the story. They came from South Africa, South America, Europe, you name it, all over the world, right? And in one moment, you know what I think? When they get into my office, I always tell them in the exam room, I say to them, think for a moment that you are sitting in my living room and we're gonna discuss all the medical issues, but we can share a little story there. And before I get in, because I prepare my notes and I know who's coming, and since I have such good relations with them, my schedule is always full. So I know who's coming the next day, right? And then when I get into that exam room, I think for a moment, oh, now I'm talking to somebody who is from Africa. How wonderful. So let me find something out about what's going on in that country. Even if you ask for a few minutes, they tell you what's going on.
Hmm.
And it's so amazing, that they're here, thankful, and they go back and forth. The same thing. And oh, the next one is from South America. Oh, how about this? Is an American with generations here. So I ask about things. Sometimes I tease them about languages. It's good because, being a foreigner, I know several languages and I like to learn more if I can. So I tell them it's good for their memory too, it helps.
Hmm.
So I can go on and on and on forever, but it is really amazing. I don't know how to explain. I'm a little emotional even talking about this, so don't mind me being emotional, but it is a wonderful, wonderful reward, emotional reward, primary care. So financial fulfillment is out there. You have to just be and organize yourself. And if you organize yourself right, if you bill correctly, is plenty of opportunities because in primary care, people come with many issues. You're not discussing only the heart, you're discussing whatever they have. And more you discuss up to a certain point, more you get reimbursed,
Hmm.
you have to know how to document correctly, but it's plenty of opportunities for making a great financial impact in your salary that way. And then, so these are the main things I wanted to discuss. And I think that my life now is so balanced. The work-life balance is amazing. I work 3 days very hard. But working hard in these 3 days, putting these things, these moments of emotional touch regenerates me. So I don't feel as tired.
Hmm.
I don't feel as tired. And another thing that I added, I can share that with the audience. I have always been a hugger. I have a lot of old ladies who live alone and other patients. And, especially since after COVID, we have been very distant with people.
Hmm.
We put that mask on and then we stay away because God forbid something will happen. I never felt that way, even when I had the mask on. If the patient didn't have any symptoms, I went ahead and hugged that old lady because she lives alone and she needs that. And it helped them so much. It helped me so much. So sometimes before I leave the exam room, I hear an old lady saying to me, "Where are you going?" And I turn back and I think, "Oh, I forgot something." She's like, "You forgot to hug me." So I go back and hug her, and it's wonderful. It's such a great feeling. And I read once a Harvard study that's saying that if you have 8 good hugs a day, you live longer.
Mm.
So I tell them to patients, they can hug whoever the loved ones they have. Don't forget to do that. It's wonderful. Something I wanted to share.
So I think that I definitely feel the same as you when it comes to those long-term relationships. I've been in the same practice for 23, almost 24 years now, and a
Wow.
lot of patients that I see from the very beginning when I first came out of residency are still with me today. I always like to joke with
Amazing.
them, we're both still here, so hopefully we're both doing something right,
Yeah,
right?
it's
So
amazing.
that is definitely one of the joys I feel for primary care. You mentioned that your schedule was like 16 to 17 patients, 3 days a week. You get half
Yes.
hour with each patient. But that's not the schedule of every primary care doctor, right? You
Well, you
hear
have to work for that. I
stories
agree.
of primary care
Yeah.
doctors who work for hospital systems who just pile on more patients. Every 15 minutes, they have to see 30 patients a day. What message do you have for those primary care physicians who may not have the schedule that you described?
You have to look for that schedule. Nobody gave me that schedule to begin with. You have to ask for it. You have to advocate for yourself in a nice way. wherever you are, you know. Now, since I have this online course and I'm talking to physicians and clinicians all over United States, and I really enjoy share the experience with them. I had a phone call with the administrator of a clinic the other day. She was interested. She saw my thing and she's like, how come you're doing this? How did you reach this point that, you know, every half an hour you can see patients every half an hour? And I told her that, you know, financial rewards are better for me and for the clinic, you know, because I am working better, I'm reimbursed better, and they are getting better reimbursement. So she's like, oh, this is interesting. So, you know, I think, even the hospitals, even the clinics, the management, may be open-minded if you discuss this and you realize that, you know, by having longer visit time for every patient, you can bill better, you can document better, you can do that prevention, which is so important, the annual physical exam and part of everything else, or annual wellness, and the problem that the patient has. So everybody's happy. The doctor is happy, the clinic is happy, and the patient is very happy because she doesn't have to come for just one problem. Patients are busy. We are patients too somewhere, you know? They're busy. They're not going to come just for a sinusitis and go away. They have to they have to take a day off or they have to take the time off to come and see the doctor. So if you can accommodate them doing more in that visit, they'll be extremely happy. And you'll be happy too because you're going to get better reimbursed. And the clinic will be happy because they'll get better money too. So I think it's all about communicating. I don't know why clinicians are afraid of communicating this with their own, you know, management. I don't know
Mhm.
why. I don't know why they have to kill themselves like this, like I was doing, you know, oh, for 16 years I was doing that. I wish I knew this before. You're going to say, maybe my clinic, you know, was that open-minded and gave me the chance, but, you know, we're RVU based.
Mhm.
So they said to me at the beginning, like everywhere else, and the clinicians who work RVU based, they know. They said to me that if you work 3 days and we're gonna we're gonna adjust your salary by decreasing my salary at the beginning because I didn't know how much I would bring for 16 patients a day, you know. And then my salary jumped high. Score, you know, it increased so much after 6 months when they calculated, they were surprised too. So you have to try, you have to see what works for you as a clinician, because I think each one of us, as I mentioned before, is a CEO of their own life and CEO of their own work. And if you don't advocate for yourself, who is going to do it? You know?
You mentioned billing and a few times and RVU based productivity, and that's how a lot of physicians are paid. And I'm sure that you see this yourself. A lot of physicians just simply don't know how to bill and they leave a lot of money at the table. And like you said, if you spend time with patients, you can bill for time. You can bill for a higher code if you address more issues in that visit. So, in order to achieve the schedule that you describe and some of that satisfaction that you express here, it's really imperative for physicians to really know how to bill correctly.
I totally agree because I learned so much about billing before I did this. I have a master degree in health service management that helped me, but I also independently learn about billing. Billing is very important. You cannot leave it to the billing department because there are people who bill, they're doing that job automatically all the time and they don't know what you did with your patient. And they will base everything on what you document. And if you're tired and you don't know what you're documenting, because you may talk half an hour with somebody, but if you don't document the right things in the note, they don't know what they're going to bill. They're going to bill lower because whatever
Yeah.
you're documenting. If you know about billing, you know how to document correctly. And this is the online course I have created exactly for billing and for satisfaction in primary care to maximize every patient visit. You have to maximize it. You own that to yourself for all the hard work you do.
So you mentioned, of course, your online course, but there are a lot of free resources as well in terms of how
Exactly.
physicians can bill. You could go to the American Academy of Family Physicians, you go to ACP, and I think that they have a lot of resources in terms of teaching physicians how to bill correctly because this isn't anything that they typically learn during residency.
I totally agree with you. There is so much free resources out there. And then if you use it the right way, you'll be surprised how happy you'll be with billing correctly, documenting correctly, and having more time. Because if you do that right, you have a little minute, few minutes in every visit to talk humanly with your patient and enjoy your primary care.
We talked about earlier about the medical students who may be listening to you now, and they think that primary care doesn't have the requisite prestige in contrast to some of the other subspecialties. What would you say to those medical students who don't think primary care has enough prestige?
I can share my story. When I finished my residency training, I got an offer for cardiology, subspecialty, and I turned it down because I really love the connection with patients. I really love this. And you can get this only in primary care. If I became a cardiologist, maybe at the beginning I'll make more money, but I wouldn't talk to the patient for every problem they had. I will talk only for heart, and they will come only when they had a heart issue. They will not come to see me all the time, and I will lose that connection with them. I always loved this. And I was from the beginning very certain that I would continue with primary care. And at the beginning, primary care was hard. I'm not saying it was easy because I didn't know what to do. I didn't know about billing. I was overwhelmed with the whole work. But now that I organized everything, all these 3, 4 years that I've organized everything, I really enjoy primary care so much. And I'm so glad I chose this direction, you know? I can share this. I spoke with another doctor the other day who came from another country. He was a primary care doctor there for many years. And now he's doing residency training and he's thinking of going to hospitalists or doing subspecialty because everybody tells him don't go to primary care. And he was sharing with me the connection he had with his patients in his country back home, not in the United States. And I told him, but listen, I have the same connection here and even more because I see people from all over the world,
Hmm.
not only from my own country, Albania, where I was. I don't even have many patients from Albania here anyway, where I come from, but from all over the world. So this is 10 times more rewarding if you have time. And he was surprised. He was like, wow, you convinced me. I'm going to go to primary care. So I think if medical students listen to this, primary care is amazing, but you have to have the desire to talk and connect with patients. If you're a people person, this is the place to be.
We're talking to Jerina Gani. She's a primary care physician. Today's Kevin MD article is The Hidden Rewards of a Primary Care Career. Jerina, let's end with some take home messages that you want to leave with the Kevin MD audience.
I would wish and love for every primary care clinician to reach the right work-life balance, but working less days and earning more, whatever they deserve, so they can use the free time they have, the days that they don't work, for everything their heart desire. When I started from working from 7 days a week to only 3 days in the clinic, and then these days that I'm off, I work only a couple of hours to prepare and to check the labs and tests. I had so much free time, especially the weekends were totally mine. And I was like, what am I going to do with all this time? How come I had all this time? I could have had all this time before and I never thought about it. And I started doing a lot of other things, learning more languages through Duolingo, even learning a little bit about trading. So many things that I never did, meditation, doing Pilates, and even creating this course for primary care providers that I'm talking about. So it is amazing how much time you have in your hand and how much your life will be enriched if you do this. You owe it to yourself. You have to enjoy your life, not only take care of other people.
Jerina, thank you so much for sharing your story time and insight. And thanks again for coming back on the show.
It is my pleasure. Thank you.